All right, and on that note, you're taking a short break here on The Explainer, but okay, not a break. Let's speak to the chairperson of the Salaries and Remuneration Commission, that is Lyn Mengich. And so much feedback has been coming in, including different issues in the wage bill that affect the wage bill. But it's also important to note here that there will be a wage bill conference next week from Monday to Wednesday. Is that so?
Yes.
Yes, but as we get there, just over the weekend, the president spoke about the wage bill now is at 47%, and he was saying this to explain why it might be impossible to really review the terms of doctors, but also I believe on what the medical interns have been calling for through the KMPDU themselves. Maybe you can help us understand what any negotiation in a collective bargaining agreement does to the wage bill.
So when we look at the wage bill, first, it is not just about the collective bargaining agreement, because it looks at the entirety of the remuneration in the public service. So that means it includes the judiciary, it also includes the legislative arm of government, and it includes the executive. So collective bargaining agreements are just part of that, but it is not the only way of increasing salaries. So in terms of the wage bill, there are two ways in which salaries may increase. One is the commission, insofar as state officers is concerned, we will review and set. So that is, the commission does that on its own, right? Now, then for other public officers, they may be unionized, in which case it goes through a collective bargaining agreement, or there are also those who are not unionized, and it is so those we advised the employer directly. So what is then the role of collective bargaining agreement is that it can, it has a potential to obviously increase the wage bill, because if you then agree to increase, it still has to be within the limits that the country can afford.
Right.
So that's really it. It's not just the CBA that determines the increases.
Right, and we'll shortly be listening to what the president has to say, because he explained, which I believe is what could be part of the basis of the conference next week. Let's listen to the president on this particular matter.
We are spending 1.1 trillion shillings every year to pay salaries and wages of the 2.2 trillion we collect. It is way above what we should be spending. We are spending 47%. Our wage bill is 47% of our revenues. It should be 35% according to the law. So we are way above.
All right, so that's a statement of fact. But let me ask you, when this reality you have to deal with, a country has to deal with this reality, but at the same time you have medical doctors who are saying that there's a collective bargaining agreement that was signed in 2017, which I believe SRC was also involved, right? Yes. So SRC was involved, and implementation has not happened. And the president is explaining implementation is difficult because of the wage bill question. So how serious should workers take government?
Let me start by really taking the conversation slightly away from the doctor strike, because the issue about the wage bill at 47% is not entirely about the doctor strike. This is a reality that has been there. The decision to have the wage bill conference was made in December last year, during the summit. You know that the summit is a body that brings together the national and the county governments.
Right.
So the issue about wage bills started way last year in December, and the summit made a resolution. And the resolution of the summit is to convene the wage bill conference to discuss strategies and action plans towards to 35%. Because the reality then is not about the doctor strike. The reality is the wage bill is not sustainable. At 47%, what does it mean? So you are collecting out of 100 shillings, more than 60 is going to debt. If 47 is going to wage bill, it means you have to borrow. You just don't even have enough to meet debt and wage bill. Those two alone is more than 100. So the issue we are dealing with is a much broader discussion.
Which is true. And Chairperson, I actually want to move away from this conversation, but we need to tie something.
Yeah. Because
this CBA was signed in
2017.
2017.
Yes.
The wage bill revenue ratio was 51%, close to 52%.
Yeah.
So meaning the CBA was signed when the wage bill was actually doing worse in relation to the revenue. So when they come 7 years later and ask for implementation of the CBA, and the explanation is that the wage bill is not doing well, so now it's 47% of the revenue, that's what I'm asking. Why then promise what cannot be delivered?
Let me explain the genesis of the 2017 CBA.
Yeah.
It was a return to work formula that was signed after a strike that was there for about 3 months or slightly more. And the CBA then was signed. At the moment, the issue is you cannot sign a CBA under duress to the extent that you make commitments that you cannot deliver. But I also want to clarify that it is not a general issue that the CBA has not been implemented. Remember that we have 47 counties who are employers by their own right? Then we have the national government, which also has different employers. All the level 6 hospitals are employers themselves. So we are not talking about one employer.
Sure.
And each of these employers have their own issues to do with the CBA. Some have actually fully implemented. So we are generalizing issues.
Like who? Who has fully implemented?
Most of the counties. Actually, if you ask today, look at the 19 issues that are being raised and go back and say which one pertains to which county. Remember, there are 19 issues that have been raised, right? Is it generic? That, for example, when you say we don't have there is no promotion, right? Or comprehensive medical cover. So they're being generalized to the extent that it is very important that these issues must speak to each employer and be able to isolate issues per employer. So we cannot deal with a generality that it has not been implemented.
Are you then saying the president is wrong in saying that the wage bill is high, therefore
No, not at all.
Possible?
Not at all, Sam. My issue is that the issue about wage bill is a bigger conversation, and it is not about the doctor strike. As I mentioned earlier, the decision to have the in December, it was not triggered the doctor strike. So even if there was no strike, we would still have the wage bill conference. We would still ask ourselves that question, that it is not sustainable. So the desire to get to 35% is triggered by a number of issues. And let me just, to put it in context, is as we are spending 47% on the wage bill, it then means that we are not spending enough on development. We are crowding out finances for development and for other services. So this issue is to do with broader issues than just the strike. So I want to emphasize that it was not triggered by the strike. The conversation about wage bill is a reality. And it happened, and we set this conference way before the issue about the strike.
Right.
So I agree entirely with what the president is saying, and that's why we have this conference. It is not sustainable.
Okay.
Yes.
All right. I just wanted us to listen to the president on what he said specifically to the question of medical interns so that we exit. Just to relate to the fact that he spoke in response to the medical doctors' strike, but also highlighting the question of the wage bill. Watch.
Our friends, the doctors, that we mind about them, we value the service they give to our nation, but we must live within our means. The resources we have are only sufficient to pay 70,000 shillings for intern doctors. It is not a salary, it is a stipend for only 1 year, and then they will be employed. and we want all our doctors, all our doctor interns to be taken in.
Okay, all right. So if they are employed, it has an impact on the wage bill. Then
yes,
what?
Yes. Let me explain. In fact, that's one of the reasons why we are looking at this conference. When we look at our ratio of teacher to students in the education sector, or healthcare to population, or even security sector, we still need to recruit in those sectors. We have not reached the required ratios. For us to reach those required ratios, it means that we must look at the wage bill in totality and say, can we afford to continue increasing? We have not even recruited enough, right? So the conversation is not about pay more to the ones you have. The conversation we should be having is how can we ensure that we are able, as a country, to recruit more healthcare workers, more teachers, more security sector. And the only way to do that is then to look at the current wage bill and see what do we need to do to get it to the correct ratio. So that is the conversation, Sam. It's not about don't pay the doctors more.
Right.
It's about how do we get to what the law requires, 35% of revenue.
Okay. All right. And I want us to spend some time now to understand how that wage bill has become. And there are some figures that I wanted us to take a look at that would guide us into this conversation. And, well, it might look complicated. This is actually from the Salaries and Remuneration Commission. And it shows the wage bill and how it has been moving since the year 2017-2018. At that time, the total costs was 785 billion shillings. The revenue was 1.5 trillion shillings, so that was 51.54%. That is the wage bill to revenue ratio. It went up higher in 2020-2021 to 54.77%, but has been declining since the year 2021-2022 up to now. At the moment, we are talking about 46.44% for 2022-2023, which I believe is an estimate based on your figures. And still, you have 1.1 trillion being the wage bill. When you look at that table, it appears that the absolute figures of the wage bill actually keep rising. What is changing is the denominator, which is the revenue. So we are reducing the wage bill to revenue ratio by increasing revenue, not necessarily cutting on the cost of running government.
The reason why you see that is if you look at those statistics, and you rightly say it was shared, if you look at the average cost per employee, it has only been rising by 2%. Yeah, cost per employee is 2%. And the numbers, you will see that the numbers of the public officers has been increasing. Reason being that we must continue recruiting in certain specific areas, as mentioned earlier, education, healthcare, security, because we have a growing population. We are a developing country. So what you see there is that in absolute terms, the wage bill amount has gone up. As a ratio, it has been coming down. Where you saw a spike is because of the COVID, during the COVID period.
Right.
So obviously revenue went down. So it's not just a question of revenue, it's both. And that is, the way you see that is when you then look at the average cost per employee, and you see that it is almost a constant 2%, whereas the actual number is higher. So that is the reason. So it's actually both. Revenue has been going up. The absolute amount per employee has more or less been managed over the period. And then it is whatever is growing is actually recruitment at specific sectors. But our concern then is there are other sectors that are growing that actually we need to ask ourselves, why do we need to grow on those sectors? Okay. But we can understand the three.
Right.
Yeah.
And so then when you say that the target, of course, the PFM Act requires that the wage bill has to be maximum of 35% of the revenue. Is there actually a roadmap? Is there a strategy towards that direction?
The reason why we have this conference is exactly to have that conversation. we want to look at what are the strategies that we must put in place between now and the next 2-3 years so that we get towards that 35%. And there are about 4 main strategies that we will be looking at during this conference. The first one is about productivity. And we are speaking about productivity because that is where you will then see growth in revenue if our productivity is higher.
Yep.
But it also means that we will be able to do more with the resources that we have. So that is one strategy that we will be discussing at the conference. We'll also be talking about the actual number of employees and looking at our authorized establishments. Where do we want to be? And I must hasten to add that this is not about reducing numbers. This is about saying what is the optimal number that we ought to have, right? In that conversation, we'll also be looking at duplication of functions and roles, which we know today we have duplication of functions between the national and the county governments, amongst the state corporations. There are also duplications. There are also duplications between the ministries and some of the commissions and independent offices. So those are areas that we must engage and discuss. Why do we have all this? So that's another strategy that will be discussed at the conference, and we'll come up with specific action plans.
So if there's duplication of roles, that would appear that there's redundancy?
Not necessarily. You see, it's about rationalizing the headcount. And once you have a target and you're then clear this is what we need to do, you can then decide how do we get to that number. And there are many ways of doing that. It could be that you are actually more in another area and you're lower in another. It could also be to do with how do you then get there over a period of time. It doesn't have to be today, but at least you're very clear that what should be our optimal staffing levels at every level of government.
It is interesting you speak about productivity because every transition, political transition, whether at the county or national level, new officials always come in with new staff members and eventually they're absorbed into the public service. How do you deal with that? Because it is almost certain that after the 2027 election, there will be new officers doing work that was being done by still serving officers, just that they will be deployed.
That is true. And that is one of the problems, is that every political cycle, we go through that. So the exiting administration will employ theirs just before they put them on permanent and pensionable. The new one comes in and recruits. And that's where we are talking about what should be the optimal staffing levels and what are the legislative frameworks that will guard against what you're talking about. So there will actually be very specific conversations around exactly that issue that you've raised.
What is the possibility that the political class is going to listen to you or to listen to the resolutions if there will be any?
Well, we start with the fact that it is a resolution by the same political class during the summit, that they all signed up to that resolution, that we need to get to 35%. So we are beginning with a commitment as resolution. What we will be discussing is the how. How do we get there? So where there is that commitment that has happened, and it is a resolution. So because of that, the commitment is there.
Okay. There are those then that will say that, yes, the wage bill is a concern. But if you look at the way money is being spent, you look at the reports of the control of budget, and every year or every half year, the cost of travel keeps going up. In fact, the control of budget in the report up to December 2023 found that if you have to compare with the previous financial year, the travel budget had risen to 11.4, up from just over 8 billion shillings. And that travel expenditure, I mean, everyone is busy justifying, but then there are those that feel government officials are just traveling for the sake of per diem, not necessarily for what they bring back home.
That is true. And you're right about the report by the Controller of Budget and even Auditor General. And by the way, they will also be presenting at the conference and to bring that point home. So it is true that there are areas of wastage of public funds in government today. And those areas, you have just mentioned a few. You have highlighted the issue of travel is one. We also know that there are wastages through the payroll, the way we are running our payrolls today. And we want to speak to all those areas. Our biggest concern is one of accountability. Mm-hmm. Do we hold ourselves accountable? And so every year, Auditor General will come up with their report. They will highlight all these issues, Controller of Budget, the same. But what is the consequence of that, right? So, of course, we have bodies to hold us accountable. EACC is an example. But where we are at the moment is we want to see more accountability in the public service. And in fact, one of the conversations that we will be speaking to is our culture.
Right.
All right? Because do we have a culture that we hold ourselves accountable, that we focus on the citizens and productivity? So a concern around our culture, productivity, citizen centricity, and accountability. So yes, it is definitely an issue that we must have a conversation around, and we must begin agreeing as Kenyans, how do we hold each other accountable?
And how difficult or easy is that conversation, knowing that much of the travel expenditure, including the previous financial year that ended June 2023, out of travel budget of just over 40 or nearly 40, I think it was 37.8 billion shillings, much of it went to judiciary, it went to parliament, it went to the executive, and also the executive of the county government and the assemblies of the county government. It is not the ordinary worker in government. So how easy or difficult is that conversation?
It is not going to be easy because remember that, our role is to set the rate. But how you spend is actually not even the mandate of the commission. How you spend that money is where we must then speak to our culture of accountability and our responsibility, even as the leadership. As you rightly said, most of the spenders of travel is likely to be the senior people in the three arms of government, right? And that is where most of the money goes in terms of travel. So when I talk about let's have this conversation around accountability, one of the things, in fact, I was asking in another forum is citizens also can hold their elected leaders accountable. But we don't, right? So Controller of Budget every quarter will bring out the report. And we can see in those report areas that public funds is not properly utilized. But do we, even as citizens, as civil society, as all of us, do we hold our leaders accountable?
Right.
And that's why it is a very important conversation to have, that we don't think that we are actually doing what we ought to do. Of course, there are bodies who should hold others accountable. But again, we see reports and reports, but there is very little in terms of, so what next? EACC, I must say, I've been trying to rein in some of these things. But at the bottom line is, what is our culture? Are we ethical? Because there's a limit as to how I can police you, right? If we have a culture that says this is right, this is wrong, based on our national values, we stand to be able to address the issue better than policing, because it comes from us as Kenyans saying this is right, this is not right.
And will you be showing the participants those facts during the conference? Yes,
indeed, there is a presentation on the public service culture, and it talks about those issues.
Okay.
Yes.
I'm also looking at, so the past 2 or so years have been quite difficult for the ordinary employee in this country, whether in the private sector or the public sector because of the higher taxes that have been introduced, whether it's on the expansion of the tax bands or for pay-as-you-earn, the question of introduction of levies like the affordable housing, and soon to be the social health insurance fund. So meaning the disposable income of the employee continues to fall. Never mind the wage bill in absolute figures is rising. How do you balance between a shrinking payslip versus the cost of funding that payslip in the wage bill?
It's not a very easy balance to strike, but we must then, at the end of the day, look at the bigger picture and think about the future, because today can be tough for all of us, right? But you have to make tough decisions today for the future. And the reason why I say this is when we look at Kenya today, are we building a society that is equitable or not? And the fundamentals of building an equitable society is very important. We must have shared prosperity. So yes, you can be taxed, but we then need to look at where is that tax being spent, right? Is it for the benefit of the future of this country? So I think we are in a space where we may feel that pain. But at the same time, we've got to say, is it what we need to do for the benefit of future generations and for the benefit of building a society that is more equitable and a society where we're talking about shared prosperity. And some of those things actually just requires those hard, tough decisions. Let me also mention that when you look at the taxation in Kenya and compared to other countries, even in the West, we're not higher than them. And when this conversation comes and people say, but what are we using our tax for, right? So at the end of the day, as long as, we desire to get certain services, someone has to pay. So who has to pay, right? And that's why I'm saying it's not an easy balance, but I think it is important to think about what is this tax being spent on, right? Is it indeed helping us to achieve our desired goals as a nation? And as long as it is going to do that, then we should support those initiatives. And we know that that is what the tax is all about today.
And I hear you, but you may want to reflect on the fact that, for instance, those ordinary Kenyans that we're talking about, they're the same ones who are being taxed. They're the same ones who, when they fall sick, they go to a public hospital, which currently has no the required staff as to serve them. They cannot afford the more expensive private hospitals, so they're lost. They're lost on the pay slip, they're lost on the service delivery, and here they are, waiting for government to agree with certain workers.
I think the first thing is to say, who are these who are saying, because remember there is a bracket where you are not taxed at the lower level, right? So we must be careful to say, who are we talking about?
Talking about
the group that are heavily taxed is actually the middle class.
Okay, this is what I'm talking about.
Yes.
Every person in this country who has a payslip has actually been affected.
Irrespective of what level of the payslip.
Exactly.
Yes.
And the impact of that is that the disposable income, the money they have to afford their services and to run their lives, has reduced. And therefore, if it has reduced, they can only depend on the cheaper options, which would include services like the public hospitals, which for the last 26 days or 27 days has not had a doctor. That's what I'm talking about.
Let me put it this way. The person you're speaking to that is being taxed today heavily, which is the middle class, most of them are going to the private hospitals. They're not going to the hospitals that you're talking about. So I think the conversation should be more about the person you're speaking to who actually uses the public hospitals, right? And yes, I do appreciate there is a group there that are dependent on those public hospitals. But that is the same group that requires the services, and that is why the middle income is being heavily taxed, because then we need those services where it should be. So it's just a balance of, if we have to provide services someone has to pay for it.
Okay.
So who pays for it? It has to be, someone has to, and mostly that will be the middle income group, the high income, and other sectors of the economy that generates the wealth.
Okay. There's a question here that I want to ask you as we conclude this conversation. It is from Philip Kisia, says that, ask SRC Chair, can she explain to Kenyans why the Commission recommended a higher remuneration package for CASs, yet the job weights and qualifications for CAS is way below a doctor, leave alone other civil servants? And I think you can expand it to talk about officers, senior officers, not necessarily state officers, versus senior in terms of qualification, whether it's academic or otherwise.
When we advise on salaries, there are many factors that we look at. It's not just education alone. Education is one of the factors that you look at. So when we evaluate a job, we categorize the factors that we consider as input factors, process, and impact, right? Input factors is where education and experience comes in, right? Because that is what you bring in to the job. Then there is the process, the actual work that you do. This is now what we call the process factors, and there are many factors like complexity of the job, decision-making, problem-solving as examples. That is process factors, right? Then you have the impact of what you do. That impact could be at the level, at certain levels, could be international. The impact of the decisions you make has international impact, could be national, could be so it speaks to the impact, and then how significant is that impact. So it's important then to see that the assessment of the job has those three elements, and the higher you go, the less the input factors in terms of its weight, because then it is then at that point, what is required is more to do with the impact of the role and the process. At that point, the input factor is still important, but it doesn't carry as much weight.
Okay.
So that is the reason why you might say this particular job, it has certain level of training. Why is it higher? So that's what we look at in terms of remunerating the job.
And in terms of suitability, that's a different conversation by someone else.
Yes.
During recruitment.
Yes.
Okay, maybe just some 30 seconds for you to speak about the conference on what Kenyans should expect come next week.
Come next week, on 15th to 17th at the Bomas, we will be having a conversation with all the key stakeholders. It's going to bring together stakeholders from the public sector, private sector, the civil society, because the issues about wage bill is a national conversation. So it's actually a national wage bill conference. The theme is towards 37%. And as I mentioned earlier, this is pursuant to a summit resolution that was made in December last year, recognizing that we must do everything to get towards the 35%. The benefits for Kenyans is enormous. We need to release more resources for development, more resources for services in the country, and the only way to do that is really to reduce our wage bill towards the 35%. So it's a national conversation, and all of us should be able to participate. You're not able to come to Bomas, but you can participate through our social media platforms.
Okay. Yes. All right. Chairperson, Salaries and Remuneration Commission, Lyn Mengich, thank you so much for making time for us to have this conversation. There's a place you said 37. I think
35.
You meant 35%.